Then we have the chemotherapeutic spectra. So here we have the three categories on its basis. We have the narrow spectrum antibiotics, extended spectrum antibiotics, and the broad spectrum antibiotics. In the narrow spectrum, we have those chemotherapeutic agents that can act only against the single or the limited group of microorganisms. For example, we have isoniazid, so it is active against the Mycobacterium tuberculosis only. That is why it's a narrow spectrum antibiotic. Then we have extended spectrum antibiotics. So in this case, these antibiotics are actually modified so that they can be effective against both the gram positive and also against the gram negative. So in this case, we have the example of the ampicillin. Then we have broad spectrum antibiotics. So these agents, these antibiotics, they have the wide variety of the microbial species against which they are going to produce the effect. As these antibiotics, they can drastically alter the nature of the normal bacterial flora, so there are more chances of the superinfection, especially because of the Clostridium difficile. Then we have the combinations of the antimicrobial drugs. We are going to look at the advantages and the disadvantages of the drug combinations here. So the important advantage of the drug combination is the synergism. As the synergism in the antimicrobial therapy, it is rarely seen, and they are only indicated in some special situations, or when the infection is of the unknown origin, or when the organisms is having the variable sensitivity. For example, when we are treating the tuberculosis. Then the disadvantage of the drug combination is that, so the main disadvantage of the drug combination is that many of the antibiotics, they are active only against the organisms that are actively multiplying. The other disadvantage is that if we co-administer some drugs which are having the different properties, like if the drugs are, some drugs are having the bacteriostatic activity, and some drugs are having the bactericidal activity, so the one effect is going to interfere with the other effect. So for example, the bacteriostatic effect is going to interfere with the bactericidal. So it means that now the bactericidal agents, they are not going to kill the drug, rather they are going to only suppress the growth of the microorganisms. Then there can also be some other risks, for example, development of the antibiotic resistance. Okay, then we have the drug resistance. Now what is a drug resistance? So if the maximum level of the antibiotic that was tolerated by the host is not sufficient to kill the or to suppress the growth of the bacteria, then this is referred to as a drug resistance. Now this resistance can be inherited, or it can also be acquired, and these resistant strains, they can become resistant to one or more than one antibiotics. Okay, so first we have the genetic alteration that is leading to the drug resistance. So what kind of genetic alterations can come in? Or for example, that can be due to the ability of the DNA to undergo the spontaneous mutations, or if it has ability to move from the one organism to another organism. And for the development of the acquired resistance, this requires the temporary or the permanent gain or the alteration of the bacterial genetic information. Then we have the altered expression of the proteins in the drug resistant organisms. So the examples can be the modification of the target site, the decreased accumulation, or the enzymatic inactivation. So if there's a modification of the target site, the drug cannot bind to the target site. In this way, the efficacy of the drug would be decreased. Then we have the decreased accumulation. So this can result from the two mechanisms. Either there can be a decreased uptake, so there would be definitely decreased accumulation, or it can be the increased efflux, so the drug would be constantly pumped out of it. That is why the accumulation would can also be reduced. Then the enzymatic inactivation can also destroy or inactivate the antimicrobial agent. For example, we have the beta lactamases or the penicillinases that certain strains have, and this enzyme basically hydrolyzes the beta lactam ring which is present in the penicillin, cephalosporins, and some other drugs. Then the acetyltransferases is also an enzyme that can transfer the acetyl group to the antibiotics, and in this way it inactivates the drugs. For example, the chloramphenicol and the aminoglycosides. Then we have an example of the enzymatic inactivation, in which we have the esterases. So the esterases hydrolyze the lactone ring of the macrolides. So these are the examples of the enzymatic inactivation. Then we have the prophylactic use of antibiotics. It means that we are going to use the antibiotics for the prophylactic purposes, that is for the prevention purposes, so that we can prevent the occurrence of a disease. So this is required in case of certain dental procedures or for the surgeries. So this use is for the preventive purposes rather than for the treatment. But as you know, if we are going to use them before every other procedure, so that can develop the risk of resistance development in the microorganisms. So that is why it is only restricted to certain clinical situations in which we are going to use this prophylactically. And these can be, as I told you, the dental procedures and surgeries, in which the benefits outweigh the potential risk. Then we have the complications of the antibiotic therapy. So, what can be the complication? So, these antibiotic therapy can result in the hypersensitivity, in the direct toxicity, in the superinfections. And this hypersensitivity can be due to the reaction to the antimicrobial drug or because of the products that can result after the metabolism of that drug, or it can also be related to the rate of infusion of a drug. So, okay, so that was about the hypersensitivity. Then we have the direct toxicity. High serum levels of the drug can definitely cause much toxicity, and it can be different, definitely with the different drugs. Then we have a superinfection. For example, in the broad spectrum antibiotics, there are more chances of the superinfection. Why? Because they can alter the normal bacterial flora that is present in the body. So when these normal flora they are going to be altered, the other microorganisms can overgrow on that side, and this way it will result in the superinfection. Then we have the sites of the antimicrobial action. So the antimicrobial drugs, they can be classified into number of the ways. For example, they can be classified on the basis of their chemical structure. For example, the beta lactams or the aminoglycosides, or they can also be classified on the basis of their mechanism of action. For example, some drugs are inhibiting the synthesis of the cell wall, some are inhibiting the protein synthesis, or they can also be classified on the basis of the activity against a particular type of organism. For example, some are active against the fungi, some are active against viruses. Okay, this was all about the principles of the antimicrobial therapy. Okay, so in the next video, I'll be discussing with you the beta lactam and the other cell wall and the cell membrane active antibiotics, in which we will discuss about the beta lactam compounds, the others, and there are many more. So as always, until next time.